some evil company patented?
Oh, yeah. Probably everything is patented, yes.
Maybe progress and then make the asks.
Okay.
No problem. And of course, I keep mentioning automation and digital, so I'm going to talk a little bit about the software. What does it mean to build a control software for such a platform? And it means, the setup, as we see it at the moment, is that the biologist or the user designs the bioprotocol, then the bioprotocol is compiled through the software, and the results of the compilation are stored in the microcontroller, currently an Arduino, could be another microcontroller, and then the droplets are moving according to those results. And what does it mean to compile? Well, we start having as input a bioprotocol. This is modeled as a graph, and an architecture, which is depicted there as an array of electrodes. And then we need to place mixing modules where droplets are going to mix, dilute, detection modules, and then we need to schedule those operations. So there are two big problems here, the placement problem and scheduling problems that we need to solve. We are currently working on that as well. Of course, we want to introduce some sensors, so we're going to have a sensor feedback, which means that we need to have a compilation that runs online, real time, so we need smart algorithms that are able to run much faster than the offline ones. And for any technical questions, I'm willing to take them at the end.
I will take over again very briefly. And I want to show you some of the ideas what we think this device that we are working on can be used for. Here we go. What's going on? Whoa. Doesn't want to work with me. Okay. Sorry. So we call it the personal lab. We think the main benefit is that it's automated, but as you've seen before, there is already an automation solution. So on top of that, it offers miniaturization, and it will be comparably cheap and available to many, many more people than before. And probably the main feature is standardization, because to date there is no global standard, only local standards for laboratory procedures. So when a lab comes up, like here, Max Planck or whatever, publishes a new finding in Nature and they make a big fuss about it and it's super cool and so on, less than 30% of the results are reproducible. And that is mainly due to massive lack of standards in biology, because you still manually operate the whole thing. So with the personal lab, we will be able to get rid of all of this kind of old school bio tradition and make it into something that is much more like 21st century style. And we want to call it, oops, where is it? It's stuck again. What is that? Okay, it's crashed. So we want to make bio applications with this, like smartphone applications. We call them bio apps, and we want to run bio apps for sampling the environment, analyzing substances that you collect, grow cells work with DNA, extract DNA, modify DNA, change metabolisms, so you can basically program whole genomes of organisms to make them produce specialty compounds like proteins or small-scale compounds like organic chemistry molecules that you can use for curing people or medication or whatever. And each of them will come in a special biochip. So every biochip will have its custom design for a specific application, and it's interchangeable. So we have the protocols in an online database, which you can download, and then you can get the specific biochip with certain range of features, and you can run the protocol on that biochip. You can program your own protocols, verify them, compile them, and execute them. So there will be a variety of biochips with a variety of options, probably also certain combinations. Maybe we will build them larger or stacked or whatever in the future. That will allow the users more freedom. Everything is going to be open source, and I think that's a radical change in the life science industry, because they are not really open source, they're hiding everything. And I think this is what will make this technology more successful, because there is companies that patent the stuff, but they usually don't use it for what we would like it to be used for. They just have their specific pipelines or their machine parks, and they just use this electrovetting feature in one component of a big pipeline of procedures that they come up with, and it's extremely expensive, and it's really not the concept that we have in mind. Because we're a small team, we're just 4 people at the moment, collaborating with a few other developers around the world. We want to open source it, and we hope that many of you spread the word to pick it up and contribute their developments, and that we not stay the only ones doing it. So if we manage to grow an ecosystem around this technology, I think the big companies now will probably also profit from it, because it stays open and they can continue their own research, and I hope they will see the value of this. So what could it be used for? At the moment, we're having the antibiotics crisis, often in the media as well. This here is a picture from the place where I studied in Freiburg. Freiburg University, just a hill outside of the city. And it shows a Streuobstwiese, apple plantation. And usually people in this area are quite romantic, have a romantic view on nature, and they kind of like their landscape and so on. But there's something awfully wrong here. It's antibiotic-resistant genes creeping around in the countryside. Because if you want to productively run an apple plantation, you have to spray antibiotics on your plants, on your trees, like openly spray them in the environment. And that's creating an overuse of antibiotics, which get in the environment. And through that, the antibiotic-resistant bacteria emerge with the antibiotic resistance on certain genetic elements, which they are very easily changing from one species to the other. So if you dump a lot of antibiotics on the soil, or also in us or in pigs or farming or wherever you have many antibiotics, the bacteria resist. They have evasive strategies, and they tell each other, kind of like a peer-to-peer file sharing system for genetics, how to get around this. And they do this quite effectively. So they render the antibiotics useless within 10 years after they were used the first time, globally. And the problem now is that producing antibiotics and making them, giving them for use to the population globally is quite a costly procedure. Researching it, pharmaceutical regulation and so on, make it quite a high cost operation. And the pharmaceutical companies just don't want to pay that bills anymore, because they have better drugs to sell, like heart drugs that you swallow every day for 30 years until you die, and other things that pay quite well, like cancer treatments and so forth. So they just completely dropped antibiotics research in the last 30 years. Since '87, they just don't invest in it anymore. And the antibiotics treatments that we're getting now, and I'm sure everyone had antibiotics treatment in their lives, probably too often, are just the last remaining drugs that are still available that have not been overcome with resistant patterns by the bacteria. So we're really in a shitty situation now. And 10 years ago, it would have still been possible to act against it, to do something. But they still didn't think it's worth to invest money in the health of the population. And recently, the governments, like 2-3 years ago, the governments, US, German administration and so on, found out that actually it's a problem and they started to do something. But what the pharmaceutical companies blackmail them with is say, okay, you extend our patents up to 30 years and from 20 to 30, and you give us billions, else we don't do anything. And I don't think it's really a feasible solution because the next time they will ask for 40 years patents and more billions and so forth, so it's not really going to change much. So we need to change the way that we deal with it. And I think one way is the phage therapy, which was invented by the Soviets in the First World War. Phages are little small molecular machines, you could say, that are parasiting on bacteria and just eating them, destroying them, proliferating. So it's kind of a virus, but it's not affecting us at all. It's just for bacteria. They're well known since 100 years. They're very safe. They're highly specific, only to very, very specific organisms they can target. So there's no cross reactions with our body cells or something like that. And they are programmable. And the programmable part is something that I find here very interesting because their genome is quite small. They have about 20, 30, 40 genes. You can see them schematically down here. It's in sizes that we can very well handle with organic chemistry at the moment, what we can synthesize. And by programming them, it is possible to change just a little bit, just the patch that the bacteria gets resistant to, because it's the same effect. Phage attacks, bacteria gets resistant, phage evolves, and so forth. So it's always going back and forth. But we can program the part of the phage that the bacteria knows that it's resistant against, and just overcome it very easily. And for this, we need decentralized technology because it needs to be patient-specific. So every time you would go to the doctor, imagine that you get your own drug treatment, specifically made for you. But it works for no one else but for you. So what we need is a portable, small laboratory device that can diagnose you and that can come up with the drug that you need without going through the whole industry thing. And I think this personal laboratory idea has the potential of getting there. So if we get all the bioapps in place for analysis and drug production, which is very feasible, we could come up with an open source drug production at very low cost. And then distribute it globally and get individual therapies for everyone. If you are interested in the subject, generally the future is biohacking. You can also get a book that I wrote. You can just biohacking, you get it on Amazon. It's published by Francis Verlag, just 2 months ago. Als Gentechnologie für alle, Werkzeuge der Genbastler, Biomaterial, Geräte, Software zur Bearbeitung von Genen und Praxisbeispiele und Zukunft der Gentechnik. And it's also explaining the idea of the personal laboratory. And all sorts of other questions like security issues, reliability issues, legal issues around it, and also more into depth the technology and how it's going to work. Thanks a lot for your interest. And please sign up for courses. We want to offer courses because we thought that we can do the Red Hat model with this technology. So we want to offer services and courses in the future while sharing all the technology that we're developing. Any questions? Can you come, please? Yeah?
You know that there is a DARPA project now on